This is Dr. Amir Jamali. The title of this presentation is The Long Head of the Biceps Tendon Pathology, Treatment with Subpectoral Biceps Tenodesis. An axial MRI is shown of a 55-year-old female with an injury to her right shoulder. She had a lot of pain in the front of her shoulder. The biceps tendon is shown within the bicipital groove. On this axial MRI, the front of the shoulder is toward the top of the screen, the side of the shoulder is seen toward the left, and the back of the shoulder is seen toward the bottom. This is the humeral head, which is the top of our arm bone, and the bicipital groove toward the front of the humeral head. Now we have an arthroscopic view looking from the back of the shoulder with the patient on their side. Their arm is going up toward the ceiling. The arthroscopic shaver is a metallic instrument, and it's being used to debride a tear of the shoulder labrum, which is a soft tissue structure toward the edge of the entire socket that acts like a gasket or a suction cup to hold the ball within the socket of the shoulder. If we change the orientation of the scope, the bicep tendon can be seen clearly as it goes into the bicipital groove from inside the joint. Now a probe is being used to bring the tendon within the joint so we can inspect it more definitively. As we do so, we see that there's a lot of fraying of the tendon as well as a lot of redness toward the left, which is a sign of what we call synovitis. This tendon has quite a bit of damage. On this view, there is quite a bit of bruising of the tendon toward the left of the tendon. We make a decision to perform an arthroscopically assisted biceps tenodesis, and this requires a tenotomy or a cutting of the tendon from inside the joint, and this is accomplished using a arthroscopic scissors. The biceps tendon is now seen retracting into the bicipital groove where it will be retrieved and fixed down to the bone at a later stage. The rest of the labrum tear is being debrided down to a stable edge using the arthroscopic shaver. Next, a biceps tenodesis is performed in the subpectoral region, meaning just at the level of the inferior aspect of the pectoralis major tendon. In this case, a subpectoral biceps tenodesis is performed. This is performed through a 2 centimeter incision over the inferior aspect of the pectoralis major muscle. The tendon, which had been previously cut, is retrieved through this incision and is fixed down to the bone with a screw and washer. This has been a review of the view and treatment of the biceps tendon from inside the joint using a subpectoral biceps tenodesis. Thank you.